Well, you've gotten to listen to me a little bit already today, and I'm making this presentation. I mentioned upstairs that I was going to talk about this little book, and I will reference it, but there's a lot of other things I'm going to say, and this little book is sort of like the culmination, the high point of what this is all about. So you might want to keep that nearby.
Is that book in the...
It's in the bag.
Oh, okay.
It's in the bag. You will also find that in that thick book, my presentation is there. But I'm going to tell you right now, the presentation you have does not have all the slides that I'm going to show you, because there are some photographic slides I did not put in the book because they didn't reproduce very well. And there's a couple other slides I didn't put in just to keep you awake and pay attention as I talk, okay? Now, we're going to start by doing a little simple exercise. And what I'm going to do is ask you to count out by 1, 2, 3, 1, 2, 3, 1, 2, 3. I'm going to start with this young lady here.
My name is Wendy Turner.
Just one. Just say one.
Oh, one. Oh,
One.
I'll go 2, 3,
1, 4,
2.
2.
2.
2.
Oh, where's your?
1, 2.
1.
No, 3. You're a 3.
Oh, 3.
3.
I'm a 1. 2.
3. 2. 3.
1, 2, 3.
1, 2.
3.
That concludes our talk for today. Thank you all for coming very much. I'd like all the ones to stand up for a second. Look around you. Okay. See how many ones there are. Okay, sit down. Now all the 2s to stand up for a second. And look around you. Okay. Now sit down. Now the 3s to stand up. To look around. Sit down. Now, what does this mean? By some estimates, in the course of life, 1 out of 3 people requires mental health treatment or services. So if it's not the person on the left, and if it's not the person on your right, then it must be you. You. So there are people who need mental health services. To begin, I'd like to show you a little something here. That will set the tone, I believe, for our presentation today.
The depression felt really bad.
I've been diagnosed with obsessive compulsive disorder, generalized anxiety disorder.
These intrusive thoughts keep coming into your mind. I probably had PTSD to some extent, didn't know that.
When I was in medical school, that was when the depression and the PTSD got really bad.
Bad stuff happens. You have to feel what you're going through.
After being sober for like 7 years was when my mental illness really hit me. I knew that I needed help.
No matter what you have, anything is possible. Only you have the power to change your life.
I've been able to prove I can be productive.
You should never, ever give up hope.
Hope, I think, is a future that you look forward to.
With hope, we can survive through anything.
If you have it, nurture it. And if you don't have it, go talk to somebody about it.
I think it's absolutely essential for life.
So, as you can see, this is a group of people who you recognize as being well-known. Several actors and actresses who have been very successful. Come on in, come on in, come on in. That Stephen Peck, he's the son of Gregory Peck, and he is the head of this Veterans Association of veterans who suffered from mental health problems of one type or another. A doctor, you know, so there's a doctor there who has been very successful in his practice. The bottom line I'm trying to get to is lots of people have mental health problems, and they go on to have very successful lives if they have treatment that helps them. And so today's presentation that I want to talk about is about the treatments and the availability of treatments that we have through the Department of Mental Health. So here we go. The mission of our department is to provide hope, recovery, wellness, to help people develop natural support systems and a meaningful use of their time. That's what we see as being the purpose of our work. And of course, hope, recovery, those are also spiritual or religious themes. Wellness, spiritual wellness, physical wellness go hand in hand. Natural support systems, family, church, community. Meaningful use of time. You know, not just sitting around letting time pass, but doing a job, getting an education, contributing to the community as a volunteer or as a paid worker. These are all the services that we provide in a nutshell. You wouldn't quite understand them all just by looking at this quick graph, but I wanted to say we do a lot of different things. And that's to say we have a lot of possible offerings that people can buy into and use. When should a person be referred for mental health services? When a person makes statements or acts in a manner that demonstrates emotions or thoughts which appear extreme or irrational, and which significantly impair his or her ability to carry out the normal functions of life. Having one is an area of concern. Having both leads to problems. This person can't keep a job, they perhaps can't be successful in leading their family, they can't hold relationships together. There are problems. That's when we should try to help a person get the help that can be offered. Clinical services. Many services are provided in a mental health clinic, but some can be provided in other locations. It used to be you had to come to our clinic. It's not that way anymore. We have certain groups of people, certain teams that will go out to where a person is to provide that treatment. Someone's homebound, elderly, sick. One of our teams will go to your house, will go into your home, sit down in your living room and talk with this person, work with this person. Some people say, well, I don't really want strangers in my house. That's fine. Maybe you go to your doctor's office, your medical doctor's office. Maybe that's more convenient. We'll go there. I have, I'm sure, a few clergy here. If you open up your church to us, and I don't mean the whole church, I mean like a counseling room, and one of your parishioners comes there, we'll meet them there. We'll come to your parish, sit in the counseling room with them for an hour, once a week, whatever it needs to be done. We'll give them service there. They live in a senior citizen community, a senior citizen center. They go there. We'll go there. So we'll come and bring the services to people. They don't have to come to us. Individual psychotherapy, group intervention, some kind of group activity or group psychotherapy. Medication. Case management. Case management means that someone helps a person connect with other things that they need. Food, clothing, shelter. Crisis resolution, crisis intervention. We'll talk more about crisis in just a second.
Do all these have a price tag?
Everything has a price tag. And we'll talk about that too. How to link a person to mental health services. Identify a mental health provider for the person. We'll talk about how to do that a little bit more in a moment. Get the person to agree to go to the clinic or to allow you to link him or her for services. This is the hardest part. You know, nobody wants to be known as crazy. And that's the popular way we talk about people with mental health problems. That's why I asked you all to stand up. 1 out of 3 people have a diagnosable mental health need in the course of their life. So if it isn't you, it's your wife, or your husband, or one of your children, or your mother, or your father, or your cousin, or your brother, or your sister. These aren't people that are 1,000 miles away from you. They are your family and friends, my family and friends. Many people just cover it up, keep it bottled up inside of them, and just suffer their whole life, rather than admit to the need for help. We have to fight that stigma to let people get the help they need. But if you can get them to go, then you call a provider up for an appointment. One of the things we've discovered is, if you call up and help another person make an appointment, you need to let that person get on the telephone and talk to whoever it is at the other end. If a person talks to a representative of the clinic or the health plan or the mental health service over the phone, it increases their likelihood of showing up by 50%. Just to have a little conversation, because it kind of demystifies a little bit what's going to happen. Some providers only offer walking care on the first appointment, in which case you might want to go with your friend, your sister, your brother, your mother, because they're going to have to sit there for a while. And if they go on a busy day, they may sit there for a long while. What happens at the first visit? Well, they come in the door and they sign in. And then, as part of the process, 3 things happen. A financial evaluator. Someone says, well, let's see what kind of insurance you have, or you don't have insurance, or how are you going to pay for this? So that young lady in the back was right, there's a cost. The clinical staff will interview the client. Let's talk about why you came in today. Immediate care will be provided if needed. So sometimes people come into the clinics and they're in crisis. It's a really tough, hard, difficult moment. And they need help right now. Sometimes it's, we get started today, but the next time you come, we'll dig into it. It's just like going to your medical doctor. You got to talk about finances, you get interviewed. Sometimes the doctor helps you, sometimes he says, well, you need to come back another day, we're testing or something else. And before you leave, there's a follow-up appointment set up. Now, what is a clinic like? Well, this is the front door of one of our clinics. This is our clinic in Hollywood. There's the front door. Not too scary looking, is it? And here's the reception area. You come in, the receptionist is right back there. All kinds of signs on the wall. That's where you sign in. It's a little hard to see, but there's the receptionist. I thought it would come out better than that. She's not scary at all. She's very, very nice, actually. And when you first come in, come on in, come on in, come on in. There's 2 chairs over here. Can we free up those 2 chairs for these 2 young ladies to sit down? So when you first come in, you say hello to the receptionist who will, let someone know that you're here and that you'd like to be seen. Come on in, come on in. This will prove someone came to my talk.
You're kidding me.
Sold out. Yeah. Well, if they might just show you, they don't know. You think, well, he's just in the room by himself. This is Ed. I'm Ed, but this is another Ed. And he's a really friendly guy, and he might be one of the people you first talk to. After you, maybe with the receptionist, Ed would sit down with you. Here's a little counseling room. Sit down with you and talk to you about what's going on. What do you need? What's the reason for your visit today? You'll notice that in these pictures, and in other pictures I'm going to show you, you're going to see staff, but you're not going to see any clients. We have clients, but there's privacy laws, and so we can't show you anyone's face. I'm not going to show you any clients. It'll only be staff or empty rooms, I'm sorry to say. Here's one of our therapists. She told me, tell them my office isn't always this messy. She's a very nice woman. She's a psychologist. And people come into her office and they sit down and they talk to her. She discusses what their needs are, what she can do to help them. This woman is one of our case managers, and she's calling somebody up from a phone list to check up on them. We don't call everybody, but there are some patients who we call in between visits to see how they're doing, to see if they need something, to see if they remember their next visit, to see if there's something that is going well or not going well for them. In addition to the clinical services that I very briefly have talked about, we also have supportive services. And you guys can move over here a little bit more if you want. We help establish benefits. So someone comes in and says, well, I don't know, maybe I qualify for SSI, maybe I qualify for Medi-Cal, I don't know, I never checked. Our person will help them figure out if they might qualify for some type of government benefits and help them apply for them. Housing vouchers. Some people who come to us are homeless or are about to become homeless, perhaps because of their illness. They haven't been able to keep their job. They've gone through all their savings. We'll help you get a housing voucher. We'll help you find a place to live. Want to come in? Come on in. Come on in. So it's not only that we find a voucher, we'll also find suitable housing for you. There's a seat over here. We have people who will go with our clients into the community, drive around, and check out apartments that they might be able to rent that will accept the vouchers that we provide. Help people get into school. Help them enroll. Help them find a job. Help them hook up with the Department of Rehabilitation, which is a state agency that helps people train and get their first job in many cases. And we help with family reunification. You know, mental illness, when it's in its most severe forms, sometimes causes people to really break the bonds of connection with their family, because their behavior can be outrageous at times, and family members just have to distance themselves. Once the person's able to deal with some of those issues, we try to help them get reconnected to their family, because family is the most important thing in many of our lives. So we don't just provide treatment, we provide all these other things, because you cannot help a person with the serious mental health problem if you don't attend to all these things. So we try to attend to them all. In the Hollywood Mental Health Clinic, we have a large room which is used for gatherings and sometimes for socializing events. And on this day, they were collecting clothing, because, as I said, some of our clients are very poor or even homeless. And so we're trying to gather some clothing to hand out to them. This is the opposite side of the room that I just showed you. It has a kitchen. So when we have social events, we sometimes prepare food. Many of our clients have burned a lot of bridges. They don't have friends, they don't have family. So we try to help them reconnect with family, but also to make friends. And the easiest friends to make are other members of the community who come to our clinic. We also sometimes provide things like cooking classes, because it's a chance for them to learn a skill that they may not have, and a chance to have something to do that provides an opportunity to meet other people. So we have a kitchen. This is abstract art done by one of our clients. Don't ask me what it means, I have no idea. But we do have art classes. Sometimes it's part of their therapy, and sometimes it's just recreation. Because, you know, girls just want to have fun. And boys too. There's another bit of art, with sort of a musical theme to it. So we have art classes, or art sessions, and other things to do. But what to do for someone in crisis? You know, I'm kind of talking about someone who's got a problem, and it's serious enough that they need to come in, but people sometimes are in crisis. And by crisis, what we mean is they intend to harm themselves or to harm others. That's the most severe form of crisis. Maybe in response to hallucination, to voices they hear, they're acting in a very dangerous way to themselves or others. That's a crisis, a psychiatric crisis. A psychiatric mobile response team or police mental health team can come out, if called, to try and help that person. The team will evaluate the person's behavior and their mental state. Are they hallucinating? Are they delusional? Are they extremely depressed? What is their mental state? If the person is a danger to themselves or others, they will be hospitalized, or they will be taken to an urgent care center. If the situation is not critical, we'll help them link to outpatient services. I'm going to talk about urgent care centers more in just a moment, but let me talk about hospitalization for a moment. We hospitalize people, which may be hopefully with their consent voluntarily, but sometimes involuntarily if they're really a danger to themselves or others. But we try to avoid hospitalizing people as much as we can for 3 reasons. One, there aren't very many psychiatric hospital beds in LA County. There's hundreds, but we have a population of millions. So by comparison, there's not very many. They're very expensive. And these hard economic times, everybody is a little short on cash, so there's not a lot of beds. There's hundreds of them, but that's not a lot. Second, when you hospitalize somebody, it can be difficult. It can be difficult on them and on other people. Why? Because when you go to the hospital, maybe you don't go to work for a few days, and someone gives your job away to somebody else. You don't go back to your apartment, and maybe it's the day your rent is due, and the landlord says, no rent, no room. And when you return, you find all your stuff in a box on the front porch. Maybe you're going to school or going through a training, series or something. and you miss the final exam and you fail the class. So we don't think of hospitalization as being something we want to do lightly. Because even though it's important to keep people safe, if that's not what they need, we may introduce into their lives new problems. So we do hospitalize people, but we try to think seriously about it before doing it. Psychiatric Mobile Response Team goes to the person in crisis. You call us up and we'll go there. When a person is danger to self or others or gravely disabled, this is a term that people don't quite understand. A person is gravely disabled in the legal sense if they cannot make use of the ordinary necessities of life. What does that mean? You present them with food and they don't eat it. You say to them, you know, it's raining, it's thundering, it's lightning outside, come in out of the rain, and they don't come. They have a serious medical condition and they don't take care of it. Because wouldn't we do those three things? I think we would. Sometimes because of their mental health problem, some people can't do those things. So they're gravely disabled. And again, we'll try to stabilize the person without hospitalizing, but we will hospitalize if necessary. And now for that young lady in the back, no one is left uncared for in a psychiatric emergency for lack of funds or insurance. You know, when our team drives up, the first thing they say isn't, can I see your insurance card? Or how much money have you got in your back pocket? The first question is, what can we do to help you? And the question about who's going to pay for it, we take care of later, after the situation is resolved. And in many cases, the county pays for it.
A question, on the previous slide you said call the access line.
We're going to talk about that. This is one of our PMRT teams. They don't look too scary, do they? You know, they're not big bouncers. Our teams typically do not go out and wrestle someone to the ground and tie them up and put them in the back of an ambulance to drive them away. They go in a car like this, they talk to a person, they persuade them that they should, you know, get this intensive care, and the person gets in the back seat, one of the people get in the back seat, one of our staff that is, another one drives, and they drive off to the hospital. So as much as possible, we try to avoid situations that could be violent or require physical restraint. In those occasions, and I'm happy to say it's not very common, but in those occasions when someone is such a physical danger to others that they are striking out at other people, we send a police psychiatric team or a police mental health team. And that means one police officer with one mental health worker. And they use the same strategy. They try to talk the person into accepting help. And they don't just give them 5 minutes. They'll take a lot of time to try and do that. The police officer will intervene by restraining the person only if it's a last resort, only if nothing else works. And in that case, they're still taken to the hospital. They're not arrested, they're taken to the hospital. But this is the type of team that you're more likely to see. Urgent care centers. So I said we have hundreds of hospital beds, and it's not enough. So we came up with this idea of having what's called an urgent care center. It's a place where a person can stay for up to 24 hours, and where they get medical care and psychiatric care, but they're not hospitalized. If this is successful, at the end of the 24 hours, they go back to their home and go on with their lives. And if unfortunately their situation is dire and this doesn't help them, then they go to the hospital. Currently there are 4 urgent care centers in LA County. And the one that's closest to us right here is called Exodus Mental Health Urgent Care. This picture I took just a couple weeks ago. And I'm standing on a little bridge that links the parking structure at LA County, LACUSA County Hospital to the hospital. This is Marengo Street, for those of you that know the area. So right across the street from LACUSA is this little place, this Exodus place. And if you go there, you can see it. It's quite in the open. This is the front entrance. You see it's a receptionist. He's actually also the security guard to keep people safe. And once you get inside, here's a nurse's station. Again, no clients will be shown to you, but here's a nurse. Fresh paint, newly redone, nice positive environment. This is where people sit. You come in and you need care, you're asked to sit down in one of these chairs. There's one room that has these chairs, and it's just quiet. Just a quiet room. It's another room that has chairs like this, and there's a movie going. Not a violent movie, but something, family, G-rated. And people sit there and just calm out. Now the treatment is not to have them watch movies, but the idea is that they're going to spend 24 hours there. And they're not going to spend 24 hours in treatment. No one can go through treatment for 24 hours straight. But they'll have moments in which they'll talk with the nurse, they'll talk to a therapist, or we'll talk to a doctor. This is one of our psychiatrists. He's a pretty friendly guy. His office is well lit. And you might go in and sit down with him and he'd talk to you about your problem, and maybe in some cases he'd prescribe a medication and they'd administer it right there. And you go out and sit in one of those nice Barca loungers and, watch that movie as the medication begins to take effect. And you just calm out. And every little while someone would talk to you, take you aside, work with you. Some of the people who are brought here are actually homeless. And when they're brought in, not only do they need medical care and mental health care, they need all kinds of things. So we have a room where they can shower and change their clothes. If they bring their clothes in, we wash them for them. If you stay there for 24 hours, you get hungry, so we provide meals and snacks. We have we have 2 or 3 rooms. A couple are for adults, but for younger people, teenagers, we don't take children here, but we do take teenagers here. They have a separate room, so teenagers and older adults are not mixed. And we take care of them. And hopefully between the quiet, the medication, the chance to talk to somebody, hopefully that helps stabilize them. Residential services. Sometimes people need to live someplace that they're going to be cared for. So there's acute psychiatric hospitals, other kinds of psychiatric health facilities, state psychiatric hospitals. Acute hospitals are places where people go for a short time. So the PMR team goes out, they find somebody, they take them there, they stay there 2-3 days. People very seldom stay more than a week or the very outside 2 weeks at an acute hospital. People who need a lot of care, residential care with mental health treatment, usually go to some type of psychiatric health facility. We have all kinds of different ones. We have skilled nursing facilities, we have special institutes for people with mental health problems. They live there, they have treatment there, they receive food there. Some of these are locked and some of them are open, depending on the needs of that person. State psychiatric hospitals are places where the most severely impaired people go, and typically people who are violent. And so, Metropolitan State Hospital, for example, over here in Norwalk. But we have success, and people come out of there, and they do better. This is a picture of one of those acute hospitals. This is called Gateways. Gateways is over in LA. It serves teenagers and young adults. This is the lobby. People voluntarily go here, and their families come to visit them. And when they first come in, they come in this door here. You can barely see it, but right behind this desk is sitting the receptionist. I was about to take the picture, and she goes, "What are you doing?" "Taking your picture." "No, don't take my picture! I'm hideous." "No, you're not hideous." They don't want our picture, so you duck down behind her computer. Again, no, you won't see any clients, any patients. This is an outdoor area. Some park benches, beautiful flowers, nice trees, volleyball, basketball. So, these young people need to do something besides talk about their problems. They need to go outside and play. Sure.
For young people that would go to a place like this, what type of typically problems would they have, or what kind of conversations would they have?
Yeah, they have all kinds of problems. They could have severe depression to the point where they're cutting on themselves or threaten to hurt themselves. They could be depressed or bipolar. Bipolar, high mood swings and low mood swings, and be a threat to other people. They could be schizophrenic. Schizophrenia is is mostly an occurrence that takes place after an 18th birthday. That's the most common time it strikes. But there are some young people who at 17 or 16 or even 15 have early onset schizophrenia. So those are some of the common problems that these young people will have. So we try to provide treatment, but also, recreation, other opportunities. This is kind of a dark picture. Pool tables. Pool is one of our favorite games. So this is another recreation room. And you can see up here there's some murals on the walls that were drawn by some of the patients who stayed there at one time. Here are two of the nurses in the nurses' station. It's a little hard to tell from this photograph, but this is one hallway. There's a second hallway in this direction and a third hallway in this direction. So the nurses are available. They're at their station sometimes to do paperwork. Most of the time they're out walking on the floor, working with the patients in one way or another. This is another outdoor area at the hospital. This is one of those corridors I was talking about, those 3 corridors. This is one of them. And you can see there are living quarters, and I'm going to show you a picture of that in a second. They also have these murals, which were drawn by one of the nurses. The nurse that was smiling, she drew these on the walls because she said, this place is too bland. So she went to the head of the hospital and said, can I draw some things on the wall? And they said, sure. So this is like scenes of the ocean, fish. It's really colorful. It's very nice. It illustrates that the people who work at these places care about their wards, the patients. This is a part of a room. The room is bigger than this, but I couldn't quite capture it all. But it's very simple. A bed, a little side table. Right where I'm standing is a cabinet to hang their clothes. Kids are allowed to bring some of the stuff, little dolls and the things like to hang and a poster for the wall. But they don't bring all their stuff because the hope is they're going to be here, a few weeks, a month or so, not that long. We don't want them to think this is their home. This is a place for treatment. This is the dining area. So 3 meals a day and a few snacks. Wellness center. A wellness center is a place where clients in recovery find support to maintain recovery and to reconnect. So when a person's been in treatment and done really well, and now they don't need our care that much, we don't just totally cut them off. We say, we want you to now attend our wellness center. You can come there to get your medication filled from time to time as you need it. You can come there as often as you like. You can come every day if you want. But we're going to try and link you back to the community. Especially people who have burned all those bridges I told you about earlier, need help to reconnect. So we reconnect them to health and social services, but perhaps more importantly, we link them to educational and social activities. So we say to them, look here, in your neighborhood, there's this community theater. Why don't you go down? Here, we'll help you get some tickets. Let's go down and watch the theater. Here's a dance being put on by some group in the area. You should go to that dance. Here's a job. They're looking for someone. You should go try out for this job. And they can come back to the wellness center to get encouragement and support as they try to build back their lives. Outreach to homeless people. So that team, that PMRT team, we have other groups that look just like them, the same little car, 2 or 3 people working together, and they go out and they try to win the trust of homeless people. And they try to help them connect to immediate mental health services as needed. And more importantly, over the long run, if that person will accept our help, to medical care, food, shelter, and ongoing mental health services. We have dedicated mental health services, meaning services that are focused on particular populations. So we have some teams of people who work with children and families involved with the Department of Children and Family Services. So sometimes a child's taken out of their home because the situation is dangerous. But many times there's a mental health problem either with the parent or the child or both of them.
Just want to go back a couple of steps.
Sure.
The wellness center.
Sure.
Is that the same location as the hospital? So
Usually no.
Okay. So how are they making that transition from the hospital to the wellness center? I mean, are they?
Sure. So the wellness center is usually a place that people go to, not from the hospital. Usually from the hospital you go to a treatment center, and then from the treatment center you go to the wellness center. And the people who work there provide the connection. They will tell the patient, you know, you've done so well, you've made so much progress, these things are all working well, now it's time for you to go to the wellness center. And the wellness centers are close to the treatment centers. They're a couple blocks away. But we try to separate them because we want the person to say to themselves, I've graduated. I've made progress. I don't need the clinic anymore, even though it was a good thing. I've taken a big step forward. I'm going to this new place. I should have included pictures of the wellness center, but I ran out of time. There's special folks that work with veterans. You know, there's lots of unfortunate veterans who have suffered a lot of trauma and they're homeless. And even if they're not homeless, they have PTSD. So we have special teams that work with veterans. Usually other people who have been veterans themselves. We have teams that work in the juvenile halls and camps with the youth that are detained there. And we have teams in the county jail. If you've ever heard Sheriff Baca speak, you know that the biggest mental health institution in LA County is the county jail. Meaning that there are more people with mental health problems in one place, that's the county jail, than any other place in LA County, which is unfortunate. Now, I've talked about treatment, but there's also prevention or early intervention. It means trying to get in before the problem becomes severe. Preventing it or getting involved very early in the person's life. So we provide these kind of treatments or these type of interventions in senior centers, medical doctors' offices, community centers. We try to work through different programs like the nurse family program, which a nurse goes to someone's home. Seeking Safety, which is a program that works with parents to help their teenagers. CBT for older adults. Older people get depressed. This is a program that tries to work with them on that. Oops, we're not going to go there yet. Hold on for 1 second, because I'm going to switch gears. I want to show you something. Does that work? Yeah, there it is.
I was diagnosed with depression in my late 30s. It was a struggle to do daily activities and keep a job. Therapy and medication helped me with staying active. When I was 40 years old, I got pregnant. I could not believe the news that I got. I had thought I could no longer have children. I thought, oh my God, my life is going to change. I was absolutely overjoyed. I knew this was going to be very difficult, but I really wanted to have this child. 8 months after my daughter India was born, her father left. I became a single mother. I was worried about all the things that I needed to do for my daughter when some days I couldn't even get out of bed. I felt very alone and I was afraid to fail as a mother. I felt like my daughter missed her father, but couldn't express it because she was still an infant. She was crying a lot. Not having enough support was devastating to both of us. When my daughter was 2 years, things really started falling apart. I will never forget the day I slapped my daughter. I couldn't believe it. All this time I was trying to protect her, and this is what I did. I was crushed. I shared it with my therapist, and she ended up reporting it to DCFS. And I was thinking, oh my God, now I am one of those bad mothers. But when the DCFS social worker came, she closed the case right away. She realized we needed help and connected me and my daughter with Project ABC, which helps families with very young children like myself. Having weekly therapy sessions and actually having someone come to our home for visits made a really big difference in our lives. When the caseworker spends an hour playing with my child, it affects my daughter in the most positive way. She knows that there are other people besides her mother who care and think that she's very special. As a single mother, I encourage the people who make decisions about these programs to make sure they stay around and that they are available for families who need them.
So Project ABC is one example of a program that our department funds and which an agency that works under a contract for us provides. And as you see, the idea here was that it was going to be therapy for the child and the mother because they both were suffering in some ways from the situation in which they found themselves. So that is an example of the kinds of services we provide, which some people have no knowledge of. And yet we're trying to help people in many different groups. Children as young as newborn can have mental health problems, or at least they can be in situations which can lead to mental health problems. So we try to get involved with them. Now, that little book, we're going to start talking a little bit more about this little book. I have a few more slides to show you, but let's talk about this. So right here you can see this little drawing that I showed you much earlier of all the services we provide. Okay? But, as you will see on the next slide, the next slide, we're going to talk about the suicide hotline, and that's listed right here at the top of the page. So this is a hotline that someone who feels suicidal can call. This is the kind of thing that, you need to advertise before it's needed. Before it's needed. So in your parishes, in your churches, with people you work, tell them about this ahead of time. Even people who say, no, I never need that. Because people who want to kill themselves. People who want to use the threat of suicide to get attention, tell people about it. People who want to kill themselves just go and kill themselves. So, who's that going to be? I don't know. But before they kill themselves, frequently people really want someone to stop them. They really, really want someone to stop them. And this is a chance to do it. And it's anonymous. The person picks up the phone, the counselor at the other end doesn't know who they are or where they are. So the person who's making the phone call retains the possibility of still killing themselves. But at least they've reached out, and we're trying to reach back. So this little number is a number you should try to share with others before they need it. Multiple languages, not just English. Conservatorship. Well, let's go back to the book for a second. Here on the same page, Psychiatric Mobile Response Team. Here's a phone number. Someone asked me a little earlier, what is Access? Well, Access is this phone number. It's actually a service that we provide. You can call this phone number and they will connect you to a Psychiatric Mobile Response Team that will send a team out. But they can also do other things. They can refer people to ongoing mental health care, help you find a clinic or a program in your area for somebody. So it's like an information line as well as a dispatch line.
The 213 number here?
No, I'm sorry. I'm talking about the one in the book right here. Access, right here at the bottom of this page. Sorry, I'm showing you two things at once, confusing me. I'm sorry. So, the next page, the UCC. Remember I said there's 4 urgent care centers? Well, here they are. Here's their 4 names, their 4 addresses, and their phone numbers. So what do you do to get a person into a UCC? You have them get in your car, you drive to this location, you park your car, you walk in the front door and you say, we need help. And you're in. You have a little trouble finding the place, call the phone number. You want them to know you're coming in advance, call the phone number. You want to find out if they can provide the kind of treatment you need, or your friend or your family member needs, call the phone number. Okay? UCC. Service Area Navigation Team. Well, we're going to get to that in a second. But I want you to flip a few pages if you can. And you will come to a page that says Patients' Rights Advocates, and at the bottom, Public Guardian's Office. Everyone got that page? So conservatorship. The Public Guardian's Office, that's the number right here, they help people who are frail or with serious mental illness to protect them from others who would take advantage of them. So sometimes people have no one. You know, they've burned all those bridges, and now they're older or they're sick, and some people, unfortunately, in this world would take advantage of the unfortunate and the sick. They would take their money, what little they have. Conservators take control of a person's life. They take control of their property, of their money, and they guard that for them so that no one unscrupulously takes their money, sells their property, takes their property. They can also, when appointed by a court, take control of the person's health care. So if the person themselves says, well, I don't know what I should do, I don't know if I want this health care, the judge can appoint a conservator who will say to the client, to the patient, you know, as your conservator, I will make the decisions for your health care. And amazing as it may sound, people do agree to this.
Who is over the conservator? Who's watching the conservator?
The conservator's supervisor, who reports to another person, who eventually reports to Dr. Southard that you heard speak earlier. So ultimately, Dr. Southard's responsible for this. Okay, remember that name, Dr. Southard.
Yes.
He's the one you want to hold responsible.
Okay.
Patients' Rights Office. Another phone number, same page. Patients have rights. People have rights. If they're mistreated, they get poor care. If a conservator doesn't do their job, you can call these people at one of these phone numbers and complain. You say, I want to let Dr. Southard know that his conservators aren't doing their job, or that this hospital's not doing its job, or this therapist isn't doing their job. That's where you can go to complain. Because you're right, even the watchdog has to be watched. Who's eligible for mental health services? We'll get to the rest of the pages. Just hold on to the book. A person of any age who has a diagnosable mental health disorder. We have mental health programs, honestly and truly, for children as young as newborn, up to people as old can be. Again, for the very young child, it may not be that they actually have a mental health problem, though some young children do. Not as young as newborn, but 5 or 6-year-olds, you begin to see some things. But a very young child may be in a very difficult situation. So one of the things I mentioned is the nurse family program. This is where a nurse comes into someone's home, and they spend an hour or two a week. And what they do is they observe the mother and the child, the father and the child interact. Sometimes they even take a movie camera and they film it. Then they show the parent their interaction. And sometimes they don't even have to make a comment. If you've never seen yourself on film, on a video, you'll be surprised. You say, I don't do that. Well, look, there it is, you're doing it. You do it. You know, things that you think you never do, you do. And sometimes that's all it takes to help a mother or a father more appropriately interact with their child. They see themselves, they say, I didn't know I did that. I didn't know I yelled. I didn't know I raised my voice. I didn't know I was so threatening. Or, I didn't know I was so distant and cold to my child. I didn't know that. And now I will try to be more self-controlled. I'll try to be more outreaching, more warm. For very young children, it's not so much that they have a mental illness as they may be in a situation that could cause a mental illness. Lack of affection, lack of support, yelling, screaming, violence, pushing, shoving. So, and it goes up to the oldest people. People who have some type of disorder which disrupts normal functioning may be said to have a severe emotional disturbance or disorder, or a severe persistent mental illness. And they may be a threat to themselves or others, or they may be disabled by their psychiatric condition in such a way they're unable to care for himself or herself or do the other ordinary things of life. So, who is eligible for prevention? See, the first one was who's eligible for treatment. Let me go back and show that to you one more time. Mental health services means treatment. But what about prevention? Well, prevention is a person at risk for developing a severe mental problem because he or she has experienced a severe crisis or trauma. Trauma is the biggest thing. We talked for a moment about veterans coming back from PTSD from the war. But all of us, or at least many of us, and many of our children are in war zones. You know, LA has some very violent areas. People are shooting each other on the streets in front of our houses. Even if you don't ever get shot, even if you don't even get shot at, the thought that you could walk out your door and someone's going to be shooting, that's violence. Bullying at school. You get bullied day after day, that's traumatizing. Accidents. Car accidents, train accidents, metro accidents, trauma. Earthquakes. We have them every now and then. Traumatizing. Those things can cause mental health problems. Anxiety disorders, depression, different types of behavior disorders. Remember in the little film, the woman said, "My child was too young to talk, but I think she missed her father." How did she know that? So this poor little kid was crying all the time. Didn't sleep well, didn't eat well. We call that dysregulation for small children. Because they ought to sleep through the night, they eat plenty of food during the day, they ought to be cheerful and laughing and giggling. They're not doing those things, something's wrong. That's a mental health problem. Show early signs of a mental health problem, like I just said. May qualify for appropriate prevention or early intervention services. These are the services that Adrian talked about that churches could qualify for funding if they met certain contracting requirements. You could get the money and you could do these for us. Are undocumented aliens eligible? They are eligible for emergency services and for limited stabilization services. Which means you're an undocumented alien, we're going to treat you in a crisis. And we're going to give you some additional services after that. They'll be limited to some degree, but we're not going to send you away empty-handed. And they are also eligible for PEI, Prevention Early Intervention Services, that I just talked about, for people who are uninsured. Some of the services we provide are for people with insurance. I'm going to talk about that more in a moment. And some are for people who are uninsured. Not different programs, but different amounts. We're able to put a certain amount of money aside for the uninsured and some for people who have insurance. And that's here. Medi-Cal. The Department of Mental Health is not paid for by the County of LA totally. Believe it or not, the County of LA pays for about 10 or 15% of our budget. Most of our budget comes from the federal government and the state government through the Medi-Cal and Medicare programs, the Healthy Way LA program, the Healthy Families program, the Mental Health Services Act, and then a little bit of county funding. How much money is spent by the County Department of Mental Health each year? How big is our budget? Anyone want to take a guess? Huge, yes. $2 billion. She's close, but she's not right. Do you work for the County Department of Mental Health? Ah, she's on the inside guessing at things. $2 billion is close, but it's not right. But it's close. Another guess? $4 billion? Ooh, I wish it was $4 billion. Oh. You should come and work for us. Maybe you can get it for us. $1.5 billion a year. Mental health treatment is very expensive. You know, think about what you're paying for. You're paying for someone who's gone through at least the master's degree level in college, many times doctor, PhD or MDs. Buildings, and all the things that go with buildings. Furniture, rugs, electricity, water, and all the other stuff we need. It's expensive. So that's why the uninsured have a limited amount of money, because what we do is we take most of our money, or at least a big piece of it, and tell the federal and state government, we're going to spend it on people who have your Medi-Cal program or your Medicare program. And the federal government says, okay, if you do that, then we'll pay part of the bill. So the county pays a little bit, and the state or the federal government pays more. But the problem is, the state or the federal government decides who qualifies for Medi-Cal. We don't. So some people have Medi-Cal, and they have much better coverage. Uninsured people, 100% paid for by the county. In your little book here, you'll find a little map, and that's what I'm trying to show you up here. And unfortunately, it didn't come out very well here either. I talked about the fact that I'm the district chief in service area or SPA 4. And this is a little map that shows you the different SPA areas. And you can kind of barely make it out. You can see up here is 1 is like, you know, the high desert. 2 is like the Malibu, San Fernando area. 3 is like Peak Pomona area, San Gabriel Valley. 4 is Central LA. That's my area, Central LA. Skid Row, Hollywood. 5 is I guess actually that's probably like Culver City. 6 is South Central LA. 7 is like Whittier, Norwalk. East Los Angeles. East Los Angeles is split. Half of it is in service area 4 and half is in service 7. And then 8 is like Long Beach, Torrance.
Where is the office for District 7?
District 7? It's in downtown LA. That's the headquarters office. But in each of these areas we have many, many, many clinics, hospitals, and other types of services. And that's what I want to talk about. Look at the next page. The next page has zip codes, and they're color-coded. And they also have a number, has SA, service area. So if you're in service area 7, look down under SA for 7s, and then you'll find zip codes. Or you can do the other way around. You can go down the zip codes, and you'll figure out which service area you live in or you work in. See, that's the purpose of this little graph. And the graph continues on the next page. And at the bottom, it even tells you purple is 1, dark blue is 2, bright yellow is 3. So if you said, well, I don't know where to go for services, the first thing we help you with is this little map or this list of zip codes. Find your zip code and you know what area you live in or you work in or whatever you're looking for is in. So now how do we find actual services? You can go also to our website. Here's our website address, and it happens to be right here on the front of the booklet. If you go to our website, you will find a program locator. You just put in your zip code or your city and pop up all the programs in your area or close to your area. It'll give you the phone number and the address, describe the services that are provided there, and it will tell you which of the services that were previously listed in my presentation are at that place. So you can use this little booklet, you can use our website. You can also call the access line, the number I already told you about. You can call the access people. You can call them up and say, I need to find services. They have operators who speak 14 different languages. That's not all the languages in LA. There's 100 languages spoken in LA, but the 14 most common ones, we have people that speak them. They'll help you find the services you need. They'll tell you about the services and how to get to them. So it's 3 ways to do it now. Here's a 4th way, service area navigation team. So if you look in your little book, 1, 2, 3, 4 pages in, there's this little graph, this little chart. Each navigation team is connected to one of the service areas. And as you can see, this little map, the first column, this little graph rather, this first column has service areas 1 through 8. You'll see number 4 says service area 4, Nancy Weiner. So Nancy is the supervisor. She works for me. She reports to me. And you can see next to her name, another box, Suyapa Yumanzor. Suyapa is from Peru. And the next one is Chevy Chung. And next was Phyllis Moore Hayes. And next is Veronica Quintana. Each of those people are the resource specialists for different age groups. Suyapa for children from, it says 0 to 5, that's a misprint. It should be 0 to 15. 0 to 15, that's a misprint. Chevy for teenagers, 16 to 25. We actually call it transitional age youth. Because, there are some people, they're 24, 25, and they're still kind of young mentally.
Does TA stand for?
Excuse me? Oh, transitional age youth. So it's the name we give for people in the teenage years to the young adult years. And then adult, and then older adult. 60 plus, older adult. And you can see for every service area there's a different set of people. Except Veronica. Veronica, we make her work really hard. She has to cover almost all the areas by herself. So if you knew the area, if you knew the kind of services you were looking for, even if you didn't know the kind of service, you can call one of these people. So we have the website, we have this booklet, we have the access line, we have these navigators. Those are all different ways to find the services that you or somebody else needs.
Excuse me.
Yes?
You mentioned that there was a typo. What page were you on?
I'm sorry to say there's no page numbers, but 1, 2, 3, 4 pages in. 4 pages in.
This one?
No.
Next time I'll have to have numbers put on these pages, I guess.
Thank you.
You're welcome. Okay, so I already talked about the access line. Well, let me also tell you that you can always call 911, but there is a difference. If you call this number the access number, you will get a PMRT team or a police mental health team. If you call 911, you'll get the police. That's the difference. Police mental health team, police. It's a difference. But if you need them, call them. Oh, we'll get to this in a second. Jumping the gun. Hold on. Let's go back to the booklet. A couple more things. Let's look at the next little chart. So if you went through it, the first page, the cover, you see this little chart. You see about the suicide hotline, the psychiatric mobile response team, urgent care centers, service area navigation teams to help you find things, the map, the zip code chart, patients' rights, public guardians. Now we come to another chart. This little chart at the top says outreach and engagement liaisons. And if you go down this, again, it's by service areas. And this time, if you go down the second column, you'll find my name, Ed Vidaurri. So that's the area I'm in charge of, number 4. Metro Los Angeles. Then you'll see in the next one a contact, Wendy De Leon. Wendy works for me. If you call up Wendy at this phone number, Wendy will come out to make a presentation for you. She will come out and make a presentation at your church, at your senior center, at your office, and it will cost you nothing. She'll come for free. And she'll give you this talk. Or she'll give you a talk about depression, or on treatment options, or on dealing with stress, or on childhood mental health problems. A whole bunch of different topics. Call Wendy up, she'll come out.
Don't forget to mention she does it in Spanish.
She does it in Spanish too. Thank you. Thank you. And I actually have a new worker who just began working with me on Friday. I just hired her. Her name is Young. Oh, I forgot her last name. Young An. Don't tell Young I forgot her name. Young An, who speaks Korean and English. So in Korean, we can give the same presentation also. Spanish, English, Korean. Now, clergy. What can clergy do to help with mental health care? You can recognize the person who needs mental health services. They come into your office. They say, Father, Pastor, Rabbi, Imam, help me. They need your help. You can recognize their needs. Help reduce the stigma of mental illness by providing support. It's okay. You can overcome this problem. Normalizing the experience. Many people have mental health problems. Now earlier, how many people did I say in the course of life need mental health treatment? 1 in 3. That's one estimate. There are other estimates. That's one. I have a different estimate. You know how many people I think have a mental health problem in the course of their life? 100%. That's it. 100%. All of you. All of us. And I'll give you some quick examples to prove it. Do you remember when your first boyfriend or first girlfriend dumped you? How did you feel? For how long? Did you eat well?
No.
Did you sleep well?
No.
What happened to your grades in school? You were depressed. You see that? You've been mentally ill. It was a short-term one, and it, you know, once you found some other beautiful young lady or some other handsome young man, suddenly you recovered. But at least for a while, you were bad off. Mental illness. That's short-term. And you know, you've probably had worse situations. You got to college and you didn't do quite so well. Your first job, you got fired. Maybe at some point in your life you struggled keeping a job, keeping your home. So depression and anxiety, two most common mental illnesses that we all suffer from. So we've all been mentally ill, all of us. The clergy can help normalize the experience by pointing out that everyone has suffered mental illness. It's not unusual or strange. They enlist family support. These people, when they're really bad off, they burn bridges. They need help to reconnect. Can address spiritual concerns. In some people's minds, mental illness is demonic possession. It's a sign of the devil. I want to say that from our perspective, that's not true. It's an illness, like diabetes, like cancer. You as a clergy person have the chance to help your congregant decide, am I possessed or am I sick? It's a big difference. But there may be other spiritual issues, as our speaker earlier talked about, so I won't go into that. And most importantly, perhaps, you can support the person through prayer and community. They burn bridges, so they need community. And they don't know where to turn, so they certainly need prayer. Okay, let's move on. We're almost done. You guys are good.
Ed,
yes?
along with clergy, there's also deacons.
Well, I include deacons as part of the clergy. But good, deacons. Educational presentations, no cost. This was Wendy. I talked about Wendy already. Here are some of the topics. I talked about this already. SAC, Service Area Advisory Committee. The next page, again, you'll find my name under number 4. We have a meeting once a month at which, in every service area, we meet with people from the community to listen to their concerns and complaints, in which they can give input and advice to the department. You want to come? Here's the time, here's the place, come. Come and talk to us. Tell us what you think. How we're doing a good job or not such a good job. How we can continue to do better, how we have to do better. Come and talk to us. Every SAC, there's one for every area, different time and place. Please come.
Excuse me, you
Yes.
mentioned that if you wanted Lindsay to come out for the clergy, she would. What about to a mental health urgent care? Would she come to speak with staff or?
Possibly. Give us a call. We'll talk about it. That's a possibility. Collaborating with the faith community. So we also have a faith advisory committee. They are part of the people that helped put on this conference. We're beginning to train mental health teams. If you can get some volunteers that want to be a mental health team for your parish or your church, we can help train them. What will they do? Will they provide treatment? No. It will help provide outreach to help people accept the message of mental health and then get the treatment they need. And outreach again, well, that's Wendy again. And here's the conference. Okay. We also have a free radio program. Did you have a radio program? We have a radio program, 7:30 to 8:30 Sunday mornings. So as you're getting ready to go to church, you can listen. This will prepare you because it'll bring to your mind things you can pray for when you get to church. We also have what's called Incubation Academy, which is a place where we inform potential contractors what they need to do to get a contract and get funding with us. And we do housing development. So not only do we help people find housing, we actually put money into developing housing. Currently we have about a dozen projects throughout this county developing 1,000 units of housing.
Yes.
And I guess I'm done.